You probably already know that cirrhosis is a potentially fatal liver condition that occurs when scar tissue has replaced healthy tissue in your liver. The more scar tissue a liver has, the less efficiently it will function until it no longer functions at all. At that point, which doctors call end-stage liver disease, only a liver transplant can save the patient's life. Unlike healthy liver cells, scar tissue cannot repair or replace itself, so there's no cure for cirrhosis at the moment. But there are ways to manage symptoms and complications in order to minimize damage and stop liver cirrhosis from getting worse. It's important to find and treat the underlying cause. If the cause is alcohol-related, treatment is obvious but difficult. People with cirrhosis caused by alcohol abuse have to stop drinking. People with cirrhosis caused by a relatively common disorder called non-alcoholic fatty liver disease may become healthier if they lose weight and control their blood sugar levels. Medications may help limit damage caused by hepatitis B or C. Other medications can relieve a range of symptoms that could indicate that cirrhosis is getting worse, such as abdominal pain, unusually itchy skin, frequent fatigue and drowsiness, swelling in the abdomen, feet, and ankles, nausea and vomiting, yellow discoloration in the skin and eyes or jaundice, easily bleeding or bruising, loss of appetite and unplanned weight loss, moments of confusion and slurred speech. It's important to make an appointment with your doctor if you have any of these signs or symptoms. Meanwhile, to learn more about the ways liver cirrhosis can get worse, click on the links in the description section for this video.